So I'm standing in front of what I call the wall of TBM here in our home in Vegas. And ever since we published these a few months back, we've had several requests from people wanting to know what our thoughts were, being myself and Dr. Megan Choi, and working to put these together, and a little bit how they're organized, and possibly some in-depth discussion of some of the elements. I have a couple TBMers here, Dr. Brett Butterfield and Chris Pelashevsky, and so they're giving me some audience to talk to, so I don't feel like I'm just talking to a camera. The first thing I want to say about this is, TBM has the potential to be kind of an overwhelming system. There are so many moving parts, and it covers so many different elements, not just types of care and modes of care, but also just different issues that are being addressed, from pathologies to emotions to nutrient deficiencies to allergies and infections and so forth. And a lot of times a person can study TBM and come away with an understanding of all these different moving parts and not really know how to put them together. So one of my main objectives, since I've been directing TBM now for over 10 years, is to clarify that process. And I introduced several years back the first TBM menu chart. Prior to that, everyone was just creating their own menu chart. And the singular menu chart didn't quite grasp the whole scope of TBM. And so I've known for quite some time that we really needed to completely revamp this. And I'm really proud of what we've accomplished and what we have here. And just want to give you a little bit of an overview. First of all, there are 7 charts. And the main chart, the center, the hub of it all, is the menu dynamics chart. Within the menu dynamics chart is a little box right here, and believe it or not, contained in this little tiny box is all of TBM, or at least the gateway to get to all of TBM. So we've recently celebrated our 40th anniversary. We completely redid all of our manuals, updated, reorganized, improved graphics, brought in a lot of new content, and this chart matches the 40th anniversary manuals. Of course, in 5 years, we're going to add more things to TBM. TBM is a dynamic, evolving system. But as TBM stands now, as we're celebrating our 40th anniversary, those manuals and these charts all dovetail together. And there is a way to get to every single technique and really concept that's in the TBM curriculum, that's in those manuals, from these charts. So what we had before, some things were included and others weren't, and obviously when you're working with a client or a patient, and if you're menuing, you want to know that what it is that your client or patient might need is someplace within the system, within the menu chart. So this is the hub here, and then from this chart, one of the lines here in this box here is menu charts. It's the teal colored line. And from the menu charts, you jump down to this section here, and then you can actually test to see which one of these other menu charts you would then go to. So we have additional techniques, which is right here. We have body points, which is here. We have emotional and energetical dynamics, which is another, for emotions and energy, another menuing system, but also has on it a lot of the different techniques that we use in TBM emotions, and that's right here. Then we have emotional races and program sequences, which used to take up about 20 pages in the manual. We've reformatted it and put it all into one chart. We'll talk more about that later. And then the exam sequences. So my wife, Dr. Choi, and I have taken the bulk of the core TBM procedures and we've systematized them into different exam procedures. That one lets you know if you want to work comprehensively in a certain way with a client, what that might look like, and two, also their menuing tools. And so that's why we have all the exam sequences. And there is a way here to get to everything in TBM. And most of what's in TBM, the overwhelming majority, is actually described here, how to test it and how to do it. So another objective of these was to minimize how often we were having to go to manuals and actually flipping through pages of the manual to find, how do you do this test and how do you do this correction. So the other thing I want to mention is within most of these charts, just like there's this hub, and so this hub on the menu chart takes you to, the orange takes you to orange, the yellow takes you to yellow, the green takes you to green. So you just ask, you menu down this list, get to what you need, say non-vial techniques listed here, and then you jump over to non-vial techniques. But also out here is just additional information. Now, I'll come back and we'll talk more about this in a minute, but that's the basic format. So you have this, the top left corner takes you to an expanded menu, if you will, and then there's other just resource information that is great to not have to look up, in essence, and relates to the types of topics that are here. So we come down and say, look at the exam sequences. All of the exams are listed right here. And so if you get pushed to the exam sequences chart from the main menu chart, you can then just ask which exam, go to the exam, and then find out the procedure that you need. There's a box similar to that on the emotional and energetical dynamics. There's another one for the additional techniques. Now, emotional races, they're organized a little bit differently. We'll cover that later. And so are the body points. I do want to say something about the body points being on two charts. I originally had them on one. We put them on display, prototypes, at some of our seminars, and we asked for feedback on all of these charts. And overwhelmingly, everybody said the type is too small on the body points chart. It's got to be a lot bigger. And so what I chose to do, rather than just doing a bigger chart, was to break it into two charts. And we have on one of them the list of tests with corrections, and then which refers you up here to the locations of the test points themselves. So you also just want to mention, you do not need to put all of the charts up on the wall. You can put just this one if you want and have the rest of them sitting on a shelf leaning against a wall, and when you need one, you just grab it. So you have this available for you because you may not have this much room. Or you might want to put 2 or 3 or 4 or 5 of them up and have a couple just set to the side. If you can put them all up, obviously that's great, and that's the most convenient. So I'm going to pause here, this portion, which is just kind of the introduction overall to what we have here, and I'll be restarting the video and we'll look at some of these individually.